Dissection is also something that might appear. Think of dissection when you have a patient who has relatively normal coronaries. A known complication in the cath lab is coronary dissection, and it tends to happen in patients who have normal coronary arteries. So if you've got a normal coronary projection in one view, and then subsequently other views show that artery to be occluded, and it's not related to spasm, think of dissection from the catheter injection. Any history of a difficult angiogram would support that. Also think of dissection whenever you have a postpartum woman or a patient with fibromuscular dysplasia. FMD has recently been associated with spontaneous coronary artery dissection, so look for those clues in your clinical vignette. Whenever you see dissection, it's reasonable to code also thrombus because they often go hand in hand, and remember dissection can also occur with PCI around the stent. Here's an example. This is a very young patient who had come to the lab for preoperative valve surgery. Her angiogram is completely normal. You can see here that's a right coronary artery injection. Of course, it's never good to see the hand come across the screen, and a half hour later, her artery was occluded. This was a catheter dissection. And it's simply, if you look here on the left-hand side, you can see this catheter is not quite coaxial. It's actually pointing straight at you. It's pointing anterior, but the vessel is going to the patient's anatomic right. The injection was a little bit brisk, and it was just enough to tear this vessel and cause a dissection with complete occlusion. Coronary spasm is also something you may